Could pressure to prescribe be contributing to pediatric emergency department visits? New studies show how influence from parents is changing the way doctors deal, especially with younger patients. So where's the line between advocating for your kids and pushing past doctors' expertise? We've got our own chief medical officer here of overnight diagnostics firm HealthTrack RX, Dr. Steve Goldberg, to walk us through this. What exactly are these studies showing the parents are doing?
What the clinicians are saying is that they feel pressure when they're interacting with parents who bring in kids who are ill. And about 1/3 said they feel pressure to write an antibiotic prescription, do a lab test, and frankly, write a school note. And what was really remarkable is half of the clinicians said they changed their plans when asked for an antibiotic, even when they didn't think it was necessary for like a viral illness. So that's pretty stark.
Wow.
The separate study, which looked at ER visits, over 50,000 for kids were related to medication-related issues. And over 1/3 of those were antibiotic medication issues, allergic reactions, rashes, stomach upset, dosing errors, even inappropriate antibiotic prescribing. So you have these two studies seem to be connected. Maybe too many antibiotics, maybe ER visits because of it.
Okay, let's talk about antibiotics, because while they are a great thing, especially when you're looking to treat bacteria, right? You don't always need an antibiotic. And a lot of times people who may be suffering from a virus, which are not treated with antibiotics, may be asking for the antibiotics just in case, which is really to a detriment to your body.
Exactly. And also, studies say that about 40% of people think antibiotics help viral illnesses, and they actually don't. So how can we solve this problem? There's been good studies. The basic thing is good communication. First, understand what the parent is bringing their child in for, listen carefully, find out what the symptoms are that are most disrupting the child and concerning the mom, for example, like cough. Make sure you address that cough. You don't necessarily have to give them something like an antibiotic, like steroids. So good communication is the secret to getting this right.
And how could these antibiotics, especially when you don't need them, be harming us, and especially our kids?
Our gut, our bodies have bacteria that ride the whole life with us. They have lots of functions. If you take antibiotics, you can wipe out those bacteria. And there's more and more long-term studies to say that can be a problem for digestive problems, allergy susceptibility, and other. So they are not mild things.
Yeah, and we're seeing these super bugs out there where, because we are taking so many antibiotics, we just can't, when you get a bug like that you can't even kill it with the antibiotic because our body is so used to it already. So certainly things to ponder here. Dr. Goldberg, always good to see you, and good for reminders here as we take our kids, especially in this flu season, to the doctor. You can't cure the flu with an antibiotic.
You're right, Marina. Thanks so much.